I'm just going to go to now the isolation relief for critical workers. So, look, my take on this is that this is maybe the government's way of going back to the old days of, come to work if you're sick, don't come to work if you're not. So I'm just confirming. I've just put that New South Wales in red because I'm not sure if that's the New South Wales standard or the national standard on these things. So I've just flagged that as a potential question to take offline. But in terms of critical workers who are close contacts, we've had a few questions about this. So that there's some situations where a person is a close contact, but their employer determines that their absence poses a high risk of disruption to critical services, and so that person can continue working, provided they have no symptoms and undertakes daily ROT testing. They must wear a mask unless eating or drinking, which is pretty much applies to most indoor places anyway at the moment, and must be engaged in one of the critical industries below. So we've got a list there of agriculture, emergency services, healthcare workers, social assistance and welfare, funeral, crematorium and cemetery, utilities, including energy, water and sanitation, production of food, beverage, grocery, cleaning and sanitary products, transport, postal and warehousing, and information and telecommunications. So I think what we are seeing here is, a situation now where there was just so many isolations. I mean, I think it was over 1 million isolations at one time in New South Wales, considering our population's only 8 million and probably less in the city parts, and most of those would have been city, I would imagine. That's a massive disruption to the economy or the state economy of having all those people sitting at home. So the government has relaxed these rules. My view is that it probably doesn't go far enough, because there's still a number of people who are isolating for various different circumstances. And look, at some point we're going to have to get back to common sense of, go to work if you're healthy and stay at home if you're sick. And this notion of forcing people to stay at home when someone else in their household is sick, is that really necessary? Is that sustainable? I don't know that it is. I mean, it depends on the cases, I suppose. When we're at 50,000 cases a day, that's a lot of people staying at home. So, got another question. Any reason why educational staff are not considered critical workers, although there was public health order issued for them? Yeah, that's a great question, Matt. I'm going to have to take that one offline. Look, yeah, I would have thought, particularly in the context of the teacher shortage, that reading about the teacher shortage, my understanding is that as a result of the mandates, there's been approximately 10,000 teachers that are effectively either on leave or left the system, and they've only been able to plug that gap with about 1,000 graduates and retired teachers coming back. So there's still a big gap there that the government we've got a shortage in teaching. And I would have thought, I completely agree with you, Matt. I would have thought, well, why wouldn't there be consideration for those people to return to work in those circumstances if they are not sick? I'll take that one offline, Matt, because this is dynamic. I'll have to check the current order to see if there's been any addition to that. But yeah, look, I think you make a very good point. I think that's certainly, if that is the case, well, be interested to know why, because just about every state have said that there is challenges in terms of putting enough teachers in the classroom, and maybe they think that with the reduction of teachers there'll also be a reduction of kids coming to school because of similarly because of cases. But no, great question, and I'll certainly take that one offline, and I'll try and have Andrew actually come back to you on that. So Andrew, if you could put that as a follow-up to get back to Matt on that question, that would be much appreciated. But great question, and interesting around the public health order. It's interesting also, Matt, around the public health order. I might throw to Andrew on this one as well. There's been an announcement about the booster mandates in teaching, but I don't actually know if it's part of the health order yet. So that was interesting as well.
I can confirm the announcement. When I checked about a week ago, there wasn't any indication regarding the booster shot for the education health order. So whether or not that's changed over the last week, I'm not 100% sure. But at the moment, it was just an announcement and not reflected in the health order regarding the mandate of booster shots for education employees.
Yeah, so that's interesting as well, because it's kind of almost a little bit sneaky on the government's part in terms of, oh well, we're gonna mandate it, but then the PHO hasn't, as we understand, hasn't followed yet. So that's really interesting. It's almost as if they're trying to see how many do it and see if there's going to be a big problem before committing to it. Maybe not. Maybe this is just an administrative hold-up. But yeah, I thought that was quite interesting.
Just further to that point, it looks like we've missed out on the list. I've just looked at the exemption on New South Wales Health website, and education and schooling, early childhood and education care is actually included in the list of industries. So that looks like an oversight on our part.
Thank you, Matt. Thank you, Andrew. And so there you go, Matt. Yeah, we can confirm that basically teaching is in that critical workers who can return. So there you go. Subject to those 4 dot points that we've put up in the slide. So you'll have to be patient with us on this, because honestly, these rules change so quickly and so frequently that sometimes when we put this stuff together, it can literally change while we're presenting it. So thanks for that again, Andrew.